today on set two successful doctors, Dr. Charles and Dr. Iraj. Welcome today on the show. What are some key factors to look for, especially for patients that are choosing the right plastic surgeon?
Surgeon factors, first of all. I think you've got to look at the training that your surgeon has undergone. Have they got board certification? A lot of us go on to do subspecialty fellowships in cosmetic surgery, and I think that's a good thing because you have that special expertise then, as Dr. Iraj and I do in cosmetic surgery.
Dubai, a notable hub for medical tourism.
Dubai in general, has a focus on luxury and excellence, and is trying to gain a reputation for being the best in the region in many aspects. And I think that translates into healthcare as well. So there is an evolving trend of having a very high standard of healthcare being provided for patients who are coming from all over the world to live here and make a life here. Be very honest and transparent with your patients about what their expectations are and what you can deliver as a surgeon.
I think it's a really powerful tool to communicate to patients what you can deliver and to try and get a message of safety and excellence out there. But at the same time, I think part of our job is to try and unpick that with the patients and work towards something that's achievable and harmonious and natural.
Today we're highlighting Mediclinic Middle East, a leading healthcare provider with a strong presence across Dubai, Abu Dhabi and Al Ain. Renowned for delivering high-quality clinical care, Mediclinic operates 6 hospitals and 29 clinics throughout the UAE, offering trusted medical expertise at the heart of your community. Tune in to GN Talks with two successful doctors from Mediclinic. Good morning and welcome to a new episode of GN Talks. Today we're going to be tackling the hot topics related to plastic surgery and specifically in regards to the medical tourism trend. What to consider when picking a plastic surgeon, factors driving the trend, and things to consider when choosing the right plastic surgeon, and much, much more. Please welcome with me today on set two successful doctors, Dr. Charles and Dr. Iraj. Welcome today on the show. How are you guys doing?
Yeah, very well.
Yeah, very well.
Thanks for having us.
Thanks for having us, Alina.
We're so excited to have you both. We have a lot of questions to ask you both today. But before we start, I would like to get a short brief about your expertise to the audience that's watching us today. We'll start with Dr. Charles.
So I'm a consultant plastic surgeon. My name is Charles Bain. I have an interest in both reconstructive and cosmetic surgery. On the cosmetic surgery side, I have a particular interest in breast surgery and body contouring surgery, such as tummy tucks. I trained in the UK and became a consultant there for several years before coming out here. And I'm based now at Mediclinic Parkview Hospital, and I've been working in Dubai for 2.5 years.
Amazing. Dr. Iraj?
Yeah, thank you for having me, Alina. I'm Dr. Iraj Ahmadi. I'm a consultant plastic surgeon from Australia, from Melbourne. That's where I've done all my medical training and surgical training as well. I currently work at Mediclinic Wellcare Hospital with clinics at City Hospital and Dubai Mall. And my interests are cosmetic surgery, focusing on the breast and body, as well as reconstructive surgery of breast and trauma reconstruction.
Amazing. It's a pleasure to meet both of you today. So let's start off with Dr. Charles. What are some key factors to look for, especially for patients that are choosing the right plastic surgeon? Are there any green flags, red flags?
Sure. So I think that's a great question. I think there are surgeon factors, first of all. I think you've got to look at the training that your surgeon has undergone. Have they got board certification? A lot of us go on to do subspecialty fellowships in cosmetic surgery, and I think that's a good thing because you have that special expertise then, as Dr. Iraj and I do in cosmetic surgery. And I think then once you've looked at their training and their expertise, obviously you want to have a good rapport with that surgeon.
Okay.
And you want to know a little bit about what they subspecialize in. Do they have expertise in the particular procedure you want? And then, of course, you need to get into the before and afters, see what kind of results they have, and whether it's the kind of result that you would like and whether it meets your aesthetic goals. And I think also it's really important to see the facility that they're operating in because it needs to be a safe facility, it needs to be well regulated, and it needs to be able to look after you if there are any problems post-operatively, God forbid.
Okay, and we're gonna definitely talk more into like the post-care after taking care of, after having a surgery. But before, I want to ask Dr. Iraj, what do you believe makes Dubai a notable hub for medical tourism? in your opinion, and what unique advantages does Dubai have?
I think Dubai in general, has a focus on luxury and excellence, and is trying to gain a reputation for being the best in the region in many aspects. And I think that translates into healthcare as well. So there is an evolving trend of having a very high standard of healthcare being provided for patients who are coming from all over the world to live here and make a life here. And with that, we've got some pretty good facilities. I mean, having both worked in top tier kind of hospitals abroad, the facilities here are on par with that as well. And I think following on from that, there is this notion in Dubai of providing excellent care for patients. So not only before their surgery, but after their surgery as well. And kind of providing them a niche luxury kind of treatment as well. So that is something that is evolving, and it's very different to places around the world.
100%. And also, especially Dubai, we see a lot of beautiful women from all over the world. So, Dr. Charles, you've dealt with a lot of nationalities, a lot of diversity. Is there a specific beauty trend to a specific, let's say, nationality? For example, if a patient's from Brazil, or if she's from Lebanon, or is it the case?
Yeah, I think it is. I think all nationalities and cultures have different ideals of beauty, and there's some really interesting work on that in the literature about what patients and what different nationalities find beautiful. And it is different, and you can see that with the different morphology, different body shapes that different cultures have, and what they might find aesthetically ideal. And I think our job as a plastic surgeon is to pick up on that and identify it with the patient, and not try and create one homogeneous look. But to really make sure it's sensitive and harmonious with the patient that's in front of you and their, as you say, cultural background.
100%. Dr. Iraj, I want to ask you, have you ever had a patient come up to you and tell you, I want to look exactly like the celebrity?
I think I've been lucky that most of my patients have been pretty sensible and realistic about their ideas of what their surgery is going to be like. Definitely some patients will come in with very specific concerns. And I think in those patients, you have to kind of be very honest and transparent with your patients about what their expectations are and what you can deliver as a surgeon. Obviously, you want to achieve their goals, but you can't achieve something that's physically not possible. And so I think that's the key thing, is adjusting patient expectations and making sure that they understand actually what you can deliver as a surgeon, because then that's how you ensure that you'll get good quality outcomes for your patients. But often patients will come with particular things that they're not quite happy about themselves, and show you pictures or things of what they want to improve. And sometimes actually what they need is not what they come in thinking as well. So that's part of your job, is to be able to guide them, not to follow trends in what they see in celebrities, but to actually get a better understanding of what they need from a personal point of view.
Dr. Charles, speaking about trends, now with the digital presence and, with all the filters happening, how has it impacted the industry, specifically in plastic surgery?
In terms of social media?
Yes, in terms of social media. Like, have you ever had a patient come to you? Because, we have a lot of filters that go on, and sometimes it's unrealistic. So
I think all of us as plastic surgeons have a bit of a love-hate relationship with social media. I think it's a really powerful tool to communicate to patients what you can deliver, and to try and get a message of safety and excellence out there. But at the same time, I think, we have to make sure that we're not promoting a dysmorphic, an abnormal ideal, which is unachievable. And we're not preying on patients' insecurities with that. And I think that's one thing that, unfortunately, social media has served to magnify. It's patients seeing beauty delivered to their telephone or their device, and thinking, I need to look like that. And I think part of our job is to try and unpick that with the patients and work towards something that's achievable and harmonious and natural.
Just for the audience that are watching us today, and they want to know, what does body dysmorphic disorder mean? If you could just give them a little bit of a short brief. Sure.
So body dysmorphic disorder is actually a psychiatric condition, which is where patients have an abnormal fixation with a particular feature or features of their body or face. And it is actually the true disorder is a contraindication really to performing cosmetic surgery, because those patients, they don't need surgery, they need mental health help. And so as plastic surgeons, we have to be slightly psychologists, not to replace that service, but to pick up those patients and send them to get the care they need before offering surgery. Really important.
Amazing. Dr. Iraj, I want to ask you, there's a stereotype now that's going on about all women looking like each other. All women have the same face structure. They have... What's your intake on this? And how do you also maintain the natural beauty of the patient rather than,
Yeah, I think especially in Dubai, you do see that there are essentially cosmetic surgery trends that are being followed.
Yes.
Like loosely speaking, there's kind of two trends. One is like a very exaggerated changing of oneself to fit a particular appearance. And then the other one is one that's a bit more subtle and a bit more respecting the normal kind of anatomy and the normal facial structures or body structures. And I think that comes down to like an expertise as a surgeon is being able to kind of guide the patients to doing something that's a bit more natural and, fitting their own kind of, I guess, body proportions and their body expectations rather than going down an unrealistic and kind of an appearance that's not natural. But I guess trying to match one of the trends that's happening in Dubai is that last year you would notice that a lot of patients were having quite a significant amount of facial filler.
Correct.
And there was a trend that multiple mils of filler was being used per session, and patients were having repeated treatments. And I think patients have seen the complications of that. They've seen the effects of that in terms of how it's changed their appearance and how they're needing to maintain that. And I think you're starting to see that probably that's less common these days, that more patients opting for more conservative kind of non-surgical facial filler treatments.
Correct, because now we see a lot of people also trying to dissolve the fillers that they had.
Correct.
And they want to have a more natural look. This is the current trend that we have. The next 6 months we don't know.
Yes.
But currently for now we see a lot of ladies wanting to go back to their natural beauty. Dr. Charles, what is some of the most popular plastic surgeries that are highly requested from patients nowadays?
So I have a particular interest in breast surgery, cosmetic breast surgery, and also cosmetic body contouring, so things like tummy tucks.
Okay.
And I think, a lot of my patients one of the commonest procedures is a tummy tuck, which is a great procedure in a carefully selected patient. It's often patients who've lost weight, male or female, or women who've had postpartum, who've had babies. And sometimes they lose the core strength, the muscle definition of their tummy wall, as well as having excess skin, which they can't shift. So that can be a really powerful procedure. And I think on the side of breast surgery, I think it's breast augmentation is popular, as well as uplift and reduction surgeries. They're all similarly popular.
Speaking about the breast augmentation, there's a rumor that says that correct me if I'm wrong, that the substances that are used under the breast or in the breast can cause some complications and should be changed every 10 years. Has has that changed? Has this misconception been changed?
Well, I think breast implant technology has progressed a great deal, even in the time since I've been practicing, but certainly over the last 40 years, it's come on leaps and bounds. So breast implants are now much safer, they last much longer, and they have a much better aesthetic appearance. But that said, there are complications or rather things that happen around a breast implant after surgery. So the body forms a natural scar layer, for instance, which can change the appearance of the breast over time. And theoretically, breasts can rupture, although the breast implants can rupture, although the rate of that is still very low with the best implants. So I think often for aesthetic reasons, rather than necessarily implant-related reasons, the breast implants sometimes do need to be changed at around the 10 to 15 year mark. But there's now no absolute mandate to do that if the breast implants are fine and sitting well. Dr. Iraj, let's talk more about like the post-care surgery. What are things that patients should consider? I know it depends, I think, depending on the type of surgery that they had done, correct? But what are some of the tips that you could give to the patients?
I think, in terms of like finding a surgeon, or in terms of, essentially choosing someone you're comfortable with, the key thing is that if I or Charles operate on someone, we essentially offer ourselves to the patient for the ongoing care for as long as it takes, whether it's a week after, a month after, 12 months after, you're responsible for that patient's care. So I think firstly it's making sure that if a patient is trying to choose a surgeon, to make sure that they have appropriate follow-up and care, because unfortunately a lot of times patients will undergo cosmetic surgery here and in a lot of places, and there's no appropriate follow-up for them. So that's like the first thing. Then secondly, I guess in terms of follow-up, it's maintaining, essentially making sure that the instructions provided by the surgeons are clear. Whenever I provide post-operative instructions for my patients, you take into account what it's going to be like. Are they going to be able to walk after the surgery? What your expectations are, how quickly we can get them back to their baseline. So you have to have very clear instructions with all of these sorts of things. But also just trying to make the post-operative recovery easy for the patients in terms of dressings, access to a surgeon or a nurse, how frequently you'll be seeing them afterwards. If there is a problem, how soon can they get that treated as well? All these things need to be considered when you're providing advice or getting advice as a patient regarding your post-operative care.
Dr. Charles, what are some risks or complications that could happen sometimes during surgery, after surgery? What's your feedback on this?
So I think that's really important to have that discussion with your surgeon, because every specific cosmetic procedure has a set of risks that could potentially happen. And often these don't happen, but you need to be aware as a patient before you go into surgery that the potential risks in the short and long term, as you say. And that really varies quite significantly dependent on what procedure is being performed. But I think the main take home is, as Iraj has said, having a surgery, particularly if you have it abroad and then not having the follow-up there is potentially a very dangerous thing to do. And I think that's one of the things that we see from patients that have flown out and had surgery, is that they're not followed up. And if anything goes wrong in that post-operative period, then there's no help, and patients can get into trouble for that. So I think patients should always, ask what the risks are, ask what the percentages are of those risks or ballpark figures, and in the surgeon's practice, and then ask what could be done about them if they did occur. And that's a good way to go about things.
Okay, thank you for sharing those details with us. Let's talk about cost savings when it comes to, Dubai. We know it's a safe place to perform a plastic surgery. We know that we will be taken care of. But some people be like, I don't want to go to Dubai and have my surgery there because it's relatively higher in terms of price. So Dr. Iraj, what would you say?
I think many factors go into working out the price. Unfortunately, I've seen numerous patients who live in Dubai, who've traveled overseas to have cosmetic surgery. They've gone to various countries to have these procedures done. And in general, it might be cheaper to have the procedure done, but the other costs that are involved, obviously involving the travel, the time that you spend there, and the time you're away from your family and people that can look after you. And then unfortunately, when these patients have complications and they come back to Dubai, the treatment often is not covered by your insurance, so you have to pay out of pocket again. The cost for that can be quite high, and often the cost to manage complications is not just a quick fix. Like sometimes, I've had patients who've had abdominoplasty done overseas. When they come back to Dubai, the entire wound has fallen apart. And they require multiple operations to remove all the dead tissue, to clean everything. You sometimes utilize devices such as vacuum dressings. All these things cost a lot of money. In the end, the cost of this ends up being 3-4 times as much as what they would have paid for the surgery here. Obviously, complications can happen anywhere in the world, but these patients then endure like an unexpected cost in managing the complications. And then also when you have these complications and you have to have time off from work, all these costs end up kind of adding up. So sometimes it's easier just to accept a slightly higher cost, but have that insurance that you're going to be looked after. And God forbid, if something happened, you would be in good hands after that.
100%, no doubt. Patients that come to both of you will definitely be taken care of. You guys have a very positive reputation, especially in the UAE, and that is why you guys are with us today on the show. Dr. Charles, has there ever been a patient that came up to you and told you that they wanted to undergo a certain surgery, but then you had to refuse because of the complications? Probably that had, I don't know, created a response to the patient. What if the patient really insists that they want to? I'm sure you guys have been through this. They insist that they want to do the surgery, but you insist to say no because it's not the best for them. So what's your approach to this?
Yeah, I think that can be a difficult situation. But when we, as plastic surgeons, are assessing a patient, first of all, we need to make sure we can meet their goals. And I think that is one of the reasons why I think one needs to meet with their surgeon at least 2 times before a surgery, is to assess those goals and work together and make sure that we're both talking about the same outcome. And that can be lacking in some patients when they fly overseas and they meet the surgeon for the first time on the day of surgery. And then once we've worked out those goals, we need to work out whether the surgery is safe for the patient. So some patients have medical comorbidities which may make them higher risk. So we may not feel that it's the right time to do cosmetic surgery.
Okay.
And I think the combination of those 2 factors, whether they are medically safe to undergo the surgery and whether we feel that we can meet their aesthetic goals, are the 2 main decision points. And I think it doesn't happen very often, but occasionally one has to just say, I'm really sorry, I don't think I can help you. Perhaps you should seek a second opinion or think about this more carefully.
Okay. As doctors, this is a question that I'm sure many will probably want to ask. Have you ever had any challenges and how did you overcome them, especially when you've had patients like this? Dr. Iraj?
Yeah, I mean, I think plastic surgery is all about fixing problems, you know,
Yes.
whether it's like reconstructive problems after cancer or trauma, or even cosmetic problems where someone is unhappy about a particular part of your body. So you're constantly facing challenges in the work that you do. But yeah, I think, you know, dealing with patients who have unrealistic expectation is like a big challenge, you know.
Amazing. And a shout out to the patients, the audience that's watching us today. If you guys want to book a consultation or a surgery with either of the doctors, both of you guys are located at Mediclinic. Is there one final word you would like to share individually to the audience that's watching us today?
I think, yeah, just in the landscape of Dubai, like where you have an endless range of doctors to choose from, I think always just prioritize your health first, pick safety first, rather than following trends, rather than following who is a popular surgeon on Instagram or on social media, because things may not always be the way they perceived on social media.
That's a good point.
And to invest a bit of time before making these sort of decisions, which ultimately will affect your health and potentially for lifelong as well.
Amazing. Dr. Charles?
Yeah, I completely agree with Iraj. I think it's one of the most important decisions you can make, choosing your surgeon. So I think that would be the message I'd give to the people watching, is to take your time, look at qualifications, look at results, ensure that there is a good rapport between you and your doctor, and just concentrate on safety and aftercare.
Amazing. Thank you so much, doctors.
Thank you.
Thank you so much, Dr. Iraj. Thank you so much, Dr. Charles.
Thank you.
And we'll see you soon in an upcoming episode with another well-established business and a new entrepreneur in the industry. Stay tuned.